going on, guys? Rachid from Unit.
Nada from Unit.
Woman on the camera. Let's get it done. Right, guys, today we are going to give you some mobility. Okay, mobility is really key when it comes to anything really. It should be the first thing on your list for your training, for your lifting. If you've got any niggles, if you've got some injuries, the first thing that you always want to do is work on your movement. The majority of people that get injured in a range of motion that they don't have, okay? So for example, if you're squatting and your squat is limited to this area, as soon as we're into this problem zone here, that's when most people are going to get injured, okay? So that's just an example. I don't know if it's the best example, but anyway. Today we're going to look at the lower back. Why? You have some lower back pain?
Yes.
So tell me about your symptoms, what type of things are you feeling, and when do you get it?
I just feel like there's a lot of pressure, and I feel like it kind of restricts my movement, either when I bend down or in general, I just move in it, and I can't lift as much as well.
Lifting is a little bit.
Yeah.
So if you look at Nada in terms of physiques, we're all built differently. That's great, beautiful, there's nothing wrong with that. Nada, like myself, very long legs, long torso. So naturally as a lever arm, in terms of where the pressure builds up, is always going to be in that lower back. A couple of things, again, we want to keep it simple. We don't want to get too specific with this. Is again, we all know about this tilt position. It can have an influence, it can also not have an influence. Okay, some people do have this tilt of the pelvis and it doesn't affect them. Others, it does. And what tends to happen is there's a lot of pressure building up into this lower back region. Okay, usually, as I said, we've got this L5, L4 area. You've got 5 lumbars in the lower spine, and you've got your SI joints, which is sacroiliac joints, which is into the pelvic area, okay? You'll tend to find you have 2 muscles, muscle either side called your QL, and you'll probably find if I get some pressure points in there, it's going to be a little bit tender, okay? We can release that tension off with mobility, and we can also influence what's happening on the joints itself as well. Again, same thing, we can really dig deep into the real background. We want to keep it simple for the guys at home. Got a little bit of back stiffness, some of these things can help. So today we're just going to go through some real basic lower lumbar mobility exercises that you can do at home. You can implement it as a post-workout, as a pre-workout as well. It really doesn't matter. And the more you practice this, you'll start to get a better connectivity with your spine. So that's also really important. A lot of people tend to, again, hitch from that upper spinal area, and they don't have much control in the lower lumbar region. So it's pretty normal, it's pretty common. Again, we're not here to fix everything. No one is biomechanically perfect. So it really is, we're just responding to the fact you're getting some pain and discomfort. We'll give you guys probably 5 exercises to go through today. We'll show you guys, and then you can practice them yourself, see how it goes. Okay, let's get it on.
Okay, let's
so
go.
All you guys need is the mat, okay? Get on the floor, soft surface, you're gonna lie on your back, nice and easy to begin with, okay? We're gonna bring the knees up towards the chest, feet are gonna stay towards the floor, and we're just literally gonna be moving side to side, okay? So now it's gonna stabilize with our hands. If you feel you've got too much pain doing this, you can actually widen the stance of the feet and just limit the rotation that you're gonna be going for. You got any pain when you do that?
No.
Okay, so you can bring the feet together and we can go into full rotation. Other things to think about when you're doing this as well, how close do you want the heels towards the bum? You get a little bit more tension onto the spine if you bring the feet in. So that's a super easy one to do. Next one we're going to go with is going to be spinal control, okay? Into your tilting positions. So all I'm going to get Nada to do is find a gap underneath her spine. So I want you to arch your lower spine, good? Okay, and now I want you to try and press that spine flat on my hand. A little bit more. And you can already see she's struggling to get that posterior tilt. So that might be something that is influencing why she's getting some of the pain. So again, just pushing your back flat onto my hand. There you go. Try and hold that position. You'll find that the core wants to engage. We want to keep the ribs down, not into extension. And then we're going to tilt back up again. If you find it a little bit difficult to do that, you can actually take your hands, place it on the bony parts at the front of the pelvis, and actually emphasize the tilt with your hands. And you can see straight away you get that feedback. Okay? So nice and simple exercise. You can start doing this on your lower back and you can progress eventually onto a quadruped position where again you're working on that posterior tilt. So nice and easy. Okay? Right, so third one we're going to do as well, we're going to stay back onto your back again. Okay? And this time, the easiest one you can do. We're going to bring the knee up towards the chest. Okay? We're going to drop that leg down, and just pull both hands onto that, and you build some tension on that, okay? One of the simplest exercises to do, yet most people don't do it, okay? We can alternate legs as well, so come onto the other side. Again, you can see if you're getting any limitations by how much that thigh wants to go towards the floor, and we can go to double knees as well. So bring both knees up. Okay, nice and easy.
Should my head be off?
Now you want to naturally try and bring the head towards the mat. You don't want to strain onto the neck flexors or anything like that. Okay. After that, we're going to go nice flattened out, slightly more progressive. One of my favorite go-tos. You're going to bring your hands out to the side. Okay. So you're going to stabilize through here. You're going to bring one leg up. We call this one a supine scorpion. Supine meaning you're on your back, prone is on your front, and you want to bring this foot across. You're going to feel the tension already.
Yeah.
The cue for this, guys, is you need to make sure you're maintaining shoulder contact over here. If that shoulder's coming up, you're not getting true rotation for the lumbar spine. And we're going to bring the foot back up again. The thing we want to make sure we're doing with this is when we go for that toe touch, as we're engaging to come back up, we're using the glute. You're going to come back to center point, you're going to drop back down, and you're going to bring the other one up. And you're going to do the same thing again. So I'm looking at a few things reference-wise in terms of what's happening with this knee. Can she keep it as flat? This is a little bit harder going this way.
Yeah.
So again, it's a nice way. Just do one more time for the guys to see. You can see she's got tension built up through here completely. And we did some treatment before, and we found one side was definitely different to the others. And we can go into why that is. It's a number of different reasons, okay? So you've got your, just to go through with the guys, you've got the side to sides that you can do. Okay, your windscreens, you've got your knee tucks, double knee tucks, pelvic tilts, supine scorpions, okay? We will give you some more advanced mobility stuff for the lower back. Keep it simple. The magic is in the simplicity. If you complicate things, you're not going to do it. So there's some things for you guys to get done at home. Any questions, let us know. If you want us to go through anything specific injury-wise, let us know. Get it done. Well done. Peace.